I trained twice, first in Italy, then in the United States. During the course of the second training, I developed a passion for the patients and the diseases revolving around Chiari Malformation, syringomyelia, and craniocervical instability. The Chiari Malformation is, in most of the cases, a congenital disorder which affects the shape and the volume of the posterior fossa, which is the back part of the skull. 10, 15 years ago, it was considered like a rare disorder. But then with the advent of MRI, with more accurate, earlier diagnosis, it has been discovered that more than 2 million American patients have this disorder. The other problem of this disorder is that it is poorly understood. Even if a patient has in her hand or his hand, most of these patients are women, an MRI testifying that indeed the patient is affected by this disorder, there is a limited understanding by the general neurosurgery and neurological population about what the extent of the clinical involvement of this disorder, which is way past just having a headache in the back of the head. There are several fields of several organs and organ systems which are affected, and the clinical presentation is so diverse and so complex that very often the knee-jerk reaction of a treating physician is that of dismissing the patient as an hypochondriac, while indeed is a legitimate patient. If you have a cookie-cutter approach to the problem with just one specific operation without any variation, you often fall short of the desired goal. A certain array of surgical and non-surgical interventions need to be available in the hands of the treating physician for these patients to have the max out of their own treatment. So far, in the last 10 years, we have changed the way that this disorder has been diagnosed and has been treated surgically. Our mission is to change during the next 10 years how we can approach something which can be called or can be resembling of a cure. Most of my patients come to me self-referred, and they come self-referred through word of mouth from other patients who have been treated by me and my group in the past. So far, we have seen patients from all 50 states of the Union and 64 foreign countries. NSPC has offered to me a higher degree of autonomy, a higher level of support, and has strongly encouraged all the new ideas that I had to keep in my pocket so far. To my future patients, welcome to your new home.